it comes to medications and treatments, who decides what's approved? I'm Jill Horner. This is Comcast Newsmakers. With me is New Jersey State Assemblyman John Bramnick. Thanks so much for being with us.
Thank you.
This was a concern for you and for constituents coming into your office, talking about some of the treatments that they wanted to receive, but they were actually denied. Talk to us a little bit about what you were hearing from one constituent in particular.
I have a bill in Trenton. The doctors make the decisions about your health and about what prescriptions you need and what treatment you need, not insurance companies. So what's happened is, years ago, a doctor wrote a prescription, it was respected, and an insurance company paid. Not anymore. Now you have a mid-level bureaucrat at an insurance company deciding how we treat you. That is absolutely wrong. I have a bill that ends the insurance companies' overruling of doctors. The insurance companies didn't go to medical school. The doctors did. This is a real problem for constituents.
And you actually had a constituent come to you and talk about this as an issue. This was related to a diagnostic test that this constituent was actually denied.
I have a woman in my office, late stage cancer, beautiful person, goes through chemotherapy, and then they apply for basically an MRI to see how the chemotherapy was going. Denied, and then they had to appeal it, and then they got it. This is a broken system that has to be fixed immediately, because the anxiety that you go through just with your disease, and then you have to add insurance company bureaucracy, no good.
With this would be related to pre-approvals for all medications, prescription medications, and all treatments?
Yes, the doctor is the decision maker, not an insurance company. And what I believe is insurance companies have abused the system. They've overdone this pre-approval process. So my bill is a reaction to their overdoing the pre-approval process and making it difficult for patients.
With that, though, would there be a concern that insurers would stop insuring patients in New Jersey if they had these additional costs to bear?
I don't think that's a problem. I think insurance companies are doing quite well. The people who are not doing quite well is the patient, who has to suffer through this bureaucratic, tangled up web of pre-approvals. That has to end, and has to end immediately.
Would this apply to all insurers and all types of insurance?
All types of health insurance, where pre-approvals have now been a burden on the patient. And I'm hoping that this bill that will send a message to insurance companies: when a doctor says a patient needs something, pay for it.
Do you have support behind this, bipartisan support for this bill?
Paul Moriarty, who is a consumer reporter, and I are co-primes, bipartisan support, and I'm hoping both the Senate and the Assembly pass this so a patient can do what the doctor tells them to do.
Thanks for being with us.
Thank you, Jill.
We've been talking with New Jersey State Assemblyman John Bramnick. I'm Jill Horner.